This is All India Radio. We now bring you a special program on COVID-19. Good morning. I'm Sunil Verma and with me is Subhadra Ramachandran. The headlines. Health Minister Dr. Harshvardhan instructs New Delhi hospitals to take proper care of non-COVID patients. CBDT refunds over 5,204 crore rupees to help MSMEs. The rate of doubling of COVID-19 cases improves to 6.2 days in the country from 3 days due to the lockdown. Government extends regular and e-visas of all foreigners stranded in India till May 3rd. Prime Minister Narendra Modi conveys India's full support for the joint African effort against the pandemic. And US President Donald Trump unveils three-phase plan to ease lockdown and reopen US economy. Union Health Minister Dr. Harshvardhan held a video conference with Delhi Lieutenant Governor, Health Minister and medical superintendents of various hospitals in New Delhi yesterday. He instructed all the medical superintendents of the hospitals in the city to take proper care of non-COVID patients, just like the COVID-19 patients. Dr. Harshvardhan said he is receiving complaints regarding denial of treatment to patients suffering from critical ailments other than COVID-19 and who require dialysis or are suffering from heart disease. He said such patients should not be turned away as certain procedures like blood transfusion and dialysis cannot wait.
ट्रीटमेंट लेना है, ऑपरेशन होना है, ऑब्जर्वेशन होना है अस्पताल की इमरजेंसी में, वो तो टेलीफोन से नहीं हो पाएगा। इसलिए किसी को भी किसी भी मरीज को वंचित करने का इलाज से अधिकार नहीं है। ये सारे मेडिकल सुपरिटेंडेंट्स को हमने बताया है और अगर आगे से इस प्रकार की कोई भी हम लोग को शिकायतें मिलती हैं तो उसके लिए फिर अकाउंटेबिलिटी सिस्टम के अंदर फिक्स की जाएगी और जो लोग इस जिम्मेदारी में कोताही करेंगे उनके खिलाफ जो है फिर सरकार को थोड़ा सख्ती का रुख अपनाना पड़ेगा।
He added that there are dedicated COVID-19 facilities in hospitals like AIIMS and Safdarjung and 2 dedicated COVID Delhi government hospitals, LNJP Hospital and Rajiv Gandhi Super Speciality Hospital in the city. The minister said the other hospitals are supposed to take care of non-COVID patients as well. The number of COVID-19 cases in the country has climbed to 13,835 while the death toll rose to 452. Health Ministry data said the number of active COVID-19 cases stood at 11,616. As many as 1,766 people have been cured or discharged and 1 had migrated. Briefing media in New Delhi yesterday, Health Ministry officials said India has been doing better than many other countries on outcome ratio, the ratio of number of COVID-19 recoveries versus number of deaths. He said the government is making efforts to further improve this ratio. The official added that the lockdown has brought down doubling rate of COVID-19 cases from 3 days to 6.2 days in the country. The official informed that 5 lakh rapid antibody testing kits are being distributed to states and districts where high case burden has been observed. Efforts of science and technology institutes in the areas of diagnosis, vaccines, drugs, hospital equipment, accessories and general wellness have been reviewed. He said CSIR, DBT, DST and DAE are working to increase testing capacity. He said the focus is on developing new, rapid and accurate diagnostic testing kits which can give results in 30 minutes. He said government is also working on viral sequencing and vaccine development. He informed that India is working with global partners so that effective vaccines can be developed. He said the government is trying to speed up these processes. The official said there is a need to also work on development of effective drugs as there is no proven drug now. The official added India's traditional knowledge in boosting immunity is also being taken into account as part of a multi-pronged effort. Home Ministry officials said collection, harvesting and processing of minor forest produce or non-timber forest produce by scheduled tribes and other forest dwellers in forest areas have been exempted from lockdown restrictions. She informed that Department of Post has transported more than 100 tons of medicines and medical equipment to hospitals and other institutions. The official said domestic and international post during lockdown has been delivered by adopting special measures. The ICMR official in the briefing informed that ICMR is going to conduct a study in order to find out the potential effect of BCG vaccine in the fight against COVID-19. He said, till the results of the study are out and evidence is obtained, ICMR will not recommend the vaccine even to health workers.
The Indian Council of Medical Research, ICMR, has written to all states asking them to use rapid antibody tests for surveillance in COVID-19 hotspots. It underlined that the old standard frontline test for novel coronavirus diagnosis is a real-time polymerase chain reaction-based molecular test which is aimed at early virus detection. In a letter to states, ICMR Director General Dr. Balram Bhargav listed the protocol for using the rapid antibody test in hotspot area for epidemiological studies and surveillance. ICMR had yesterday said that the rapid antibody test kits procured are not meant for early diagnosis, but only for surveillance and trend checking. One more institute of the Council of Scientific and Industrial Research, CSIR, has started whole genome sequencing of novel coronavirus. Chandigarh-based Institute of Microbial Technology, IMTech, has taken up the task of large-scale genome sequencing of the virus. The Center for Cellular and Molecular Biology and the Institute of Genomic and Integrated Biology are already working on it. Director IMTech, Dr. Sanjeev Khosla, said the complete genome sequence information will enable researchers to gain insights about the virus origins, different strains circulating in India, and how it has spread across the country. He said the genomic resource obtained from this sequencing will also allow identification of new targets for diagnosis and drugs for COVID-19. The whole genome sequencing is a method used to determine the complete DNA sequence of a specific organism's genome. CSIR IMTech will perform sequencing of the SARS-CoV-2 RNA genome isolated from clinical samples. In our series, Experts Speak on All India Radio News, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Prasoon Chatterjee of AIIMS, New Delhi said, homemade masks are safe to be used.
सर्जिकल मास्क जिसको हम कहते हैं, उसका मटेरियल ही ऐसा है कि आप बहुत लंबा यूज नहीं कर सकते। अगर आपके पास कपड़े का मास्क है या आपने घर में बनाया हो या आपके पास N95 है, जो भी आपके पास अवेलेबल है, उसको अगर आप एक पेपर के पैकेट में डाल के रखते हो, पेपर के कांटेक्ट में वायरस बहुत लंबा नहीं टिकेगा और उसको सपोज 5 दिन बाद आप उसको यूज करो तो यू आर सेफ।
Dr. Chatterjee added that senior citizens must exercise maximum precautions.
उम्र के साथ साथ इम्यून सिस्टम धीरे धीरे कम होते जाती है, प्लस उनका जो बायोलॉजिकल रिजर्व है, बाउंस बैक करने का जो क्षमता है वो भी कम हो जाती है। प्लस दे हैव मल्टीपल डिजीज, जिसे हम मेडिकली मल्टी मॉर्बिडिटी कहते हैं। उनको प्रेशर भी है, उनको शुगर भी है, उनको हार्ट प्रॉब्लम भी है, घुटनों में भी दर्द है। तो सारे चीजों का एक मिक्स्ड इफेक्ट है। कोरोना जो इन्फेक्शन जब शरीर के अंदर जा रहा है, वो अपने शरीर का जो हमारा इम्यून सिस्टम है उनके साथ फाइट करके, अगर कोरोना भारी पड़ती है तो उनमें मैनिफेस्टेशन हो रहा है, अगर कोरोना नहीं भारी पड़ते हैं तो एसिम्प्टोमेटिक रह रहा है। अराउंड 80% पीपल आर एसिम्प्टोमेटिक अक्रॉस द ग्लोब अगर आप देखेंगे, बट सीनियर सिटीजन के लिए ये सच में बहुत खतरनाक है।
The News Services Division of All India Radio, in its bilingual live phone-in program tonight, will bring you a special discussion on COVID-19. Listeners can ask questions to the experts on toll-free telephone number 1-800-11-5767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. Agriculture Minister Narendra Singh Tomar yesterday launched Kisan Rath mobile app to facilitate transportation of food grains and perishables during the lockdown. Speaking on the occasion, Mr. Tomar said that agricultural activities have to go on amidst the lockdown. He said Kisan Rath app will greatly facilitate farmers, FPOs and cooperatives in the country to have the choice to find a suitable transport facility to transfer their agriculture produce from farm gate to markets. A report.
Transportation of agri-produce is critical and indispensable component of supply chain. The mobile application Kisan Rath facilitates farmers and traders in identifying right mode of transportation for movement of farm produce ranging from food grain, fruits and vegetables, oilseeds, spices, fiber crops, flowers, bamboo and coconuts. Transportation will become easier with this app as it will help farmers and traders for transporting produce from farm gate to mandi and mandi to mandi all over the country. The app will also facilitate traders in transportation of perishable commodities by refrigerated vehicles. This mobile app will be made available in 8 languages in Android version initially and is ready for pan-India use. With Dipendra, Anupam Mishra, AR News, Delhi.
This is All India Radio giving you a special news program on COVID-19. Let's take a look at the headlines once again. Health Minister Dr. Harshvardhan instructs New Delhi hospitals to take proper care of non-COVID patients. CBDT refunds over 5,204 crore rupees to help MSMEs. The rate of doubling of COVID-19 cases improves to 6.2 days in the country from 3 days due to the lockdown. Government extends regular and e-visas of all foreigners stranded in India till May 3. Prime Minister Narendra Modi conveys India's full support for the joint African effort against the pandemic. And US President Donald Trump unveils 3-phase plan to ease lockdown and reopen the US economy. For quick news updates around the clock, follow us on our Twitter handle @AIR News Alerts.
CBDT has said that income tax refunds to over 8 lakh small businesses worth over 5,204 crore rupees have been issued in the last 10 days. In a statement yesterday, CBDT said these income tax refunds will help MSMEs to carry on their business activities without pay cuts and layoffs in the existing situation. It said Income Tax Department has issued nearly 14 lakh refunds up to 5 lakh each till date to help taxpayers, keeping its focus on providing relief to the small businesses in MSME sector. CBDT will further issue refunds of 7,760 crore rupees. CBDT reiterated its request to taxpayers to respond regarding reconciliation queries about outstanding tax demands. It said that in around 1,74,000 cases, responses are awaited from taxpayers. The government yesterday extended regular and e-visas of all foreigners who are stranded in India due to the coronavirus lockdown till May 3rd on gratis basis. The Home Ministry said the visa granted to those foreigners except diplomats and UN officials who are supposed to come to India will remain suspended till May 3rd. The Home Ministry added that after considering the matter, it has been decided to extend the period of providing consular services by the Office of Foreigners Regional Registration Officers and Foreigners Registration Officers to foreign nationals presently stranded in India. Exit to such foreign nationals, if requested during this period, will also be granted up to 14 days beyond May 3rd, that is May 17th, without any overstay penalty.
Prime Minister Narendra Modi and South African President Cyril Ramaphosa have exchanged views about the domestic, regional and global challenges posed by the COVID-19 pandemic. In a telephonic conversation, both the leaders discussed the steps being taken by their governments to protect the health of their people and to minimize economic impact. Prime Minister discussed the centuries-old ties of friendship and people-to-people exchanges between India and Africa and conveyed India's full support for the joint African effort against the virus. Prime Minister Modi assured President Ramaphosa that India will provide all possible support to South Africa for ensuring supplies of essential medicines during these challenging times. Prime Minister commended the proactive role being played by President Ramaphosa as the chair of the African Union for coordinating a continent-wide response to the pandemic. Prime Minister Modi also spoke to Egyptian President Abdel Fattah al-Sisi. In a telephonic conversation, Prime Minister Modi assured the Egyptian President al-Sisi that India will provide all possible support to ensure the availability of pharmaceutical supplies during these difficult times. The two leaders discussed the evolving global situation in the wake of the pandemic and exchanged information about the steps being taken by their governments to protect their citizens. They agreed on the utility of continuous exchange of experiences and best practices in order to learn from each other. Prime Minister thanked President al-Sisi for support to Indian citizens present in Egypt. U.S. President Donald Trump unveiled a three-phase plan yesterday to reopen country's economy following the COVID-19 outbreak. The new plan allows governors to gradually ease the lockdown in their states. Talking to media during his daily White House briefing on the pandemic, President Trump said that America wants to be open and that a national shutdown is not a sustainable long-term solution. He asserted that a prolonged lockdown combined with a forced economic depression would inflict an immense and wide-ranging toll on public health. President Trump told reporters that his administration is issuing new federal guidelines that will allow governors to take a phased approach to reopening their individual states. For the first phase, the guidelines recommend that states see a downward trajectory for 14 days in the number of confirmed coronavirus cases before they move to lift stay-at-home orders and other restrictions. The second phase includes asking for all vulnerable individuals to shelter in place, encourage telework, closure of common areas, and physical distancing. The third phase is essentially returning to the new normal with better hygiene practices and respect for spaces between individuals.
Back home in Ladakh, Leh District Administration has made arrangements to issue e-passes for emergency movement during the second phase of lockdown. The district administration has made this arrangement to facilitate the general public, especially patients, labourers, government employees, through minimum human interference in issuing emergency movement passes. More from our correspondent.
Leh Deputy Commissioner Sachin Kumar yesterday launched the electronic pass system designed by a National Informatics Center. People within the district can apply through smartphone or website for passes for emergency movement during lockdown. The e-pass portal, by following simple procedure, can apply by submitting relevant personal details along with required documents like photo identity proof, copy of the doctor's prescription in case of patient or medical attention. A confirmation message will be sent on the registered mobile number and email ID. With Ramesh Chandra, Youngstown Dolma, AR News, Ladakh.
In Himachal Pradesh, one more person tested COVID-19 positive. With this, the total number of active cases has gone up to 19 in the state. Una district has the largest number of infected people in Himachal. A report.
The one fresh case of positive COVID-19 has been confirmed from the Chamba district, taking the active cases to 19 in the state. The maximum number of 12 positive COVID-19 patients is from Una district, followed by Chamba with 3 patients. Kangra and Sirmaur district have 1 each, while 2 active cases are from Solan district, whereas 12 people have recovered from COVID-19 in the state as well. Chief Minister Jairam Thakur directed the officers to increase the sampling of persons of high-risk areas for coronavirus so that the situation could be normalized at the earliest. He said hotspots of COVID-19 would remain sealed and no relaxation in curfew would be given in these areas. Meanwhile, people entering from other states with authorized permits will be tested with rapid diagnostic kits at the entry points of the borders. Sanjeev Sundrial, AR News, Shimla.
Tamil Nadu continues to witness more number of discharged COVID-19 patients than new cases. 103 people were discharged in a single day yesterday. There is no report of death in the past 24 hours. The total number of infected patients is 1,323, while the active caseload remains 1,025 people. More from our correspondent.
To assess the COVID-19 situation in Tamil Nadu, the centre has delegated a team of medical specialists to the state. The team is comprised of Dr. Piyush Jain and Dr. Dharam S. Meena of the Vardhaman Mahavir Medical College and Safdarjung Hospital, New Delhi. They arrived in Chennai last evening by a special Air India aircraft and inspected the state-level control room and the designated COVID-19 hospitals in the city. They were briefed by the Health Secretary Dr. Bila Rajesh about the activities in the containment cluster and the health infrastructure made available exclusively to overcome the pandemic. They are expected to file their report to the centre after the tour that is expected to long for a couple of days, besides suggesting to the state authorities about the additional measures to be taken. Jai Singh, AR News, Chennai.
In Telangana, 66 more people tested positive for coronavirus yesterday. With this, the number of total COVID-19 cases in the state has gone up to 766. State health officials informed that most of these cases have been reported from Hyderabad and Suryapet district, where a number of people from a single family tested positive. With this, the active COVID-19 cases in the state has gone up to 562. 186 people have recovered and have been discharged. There have been 18 fatalities so far in the state. The state government has stepped up measures to contain the spread of coronavirus. According to state authorities, 209 containment clusters have been created and special officers have been appointed to ensure strict implementation of the lockdown in these areas.
In Odisha, the state government has declared spitting in public places an offence to contain the spread of COVID-19. It is now a cognizable and compoundable offence in the state. A report.
The State Health Department has made spitting in public places an offence under COVID-19 regulation. For the first 3 violations, a fine of 200 rupees will be collected from the violators, and subsequently the fine money will be enhanced to 500 rupees. For the purposes of this regulation, extension officers in block offices, additional tahsildars, police ASI and ward officers of municipality have been declared as enforcement officers. Earlier, 2 districts from the state, Ganjam and Bhadrak, had already made spitting in public places an offence. Itish Singh Rathore, AIR News, Cuttack.
Amidst the lockdown, Bihar government has taken decision to open its offices from April 20. This decision was taken at a high-level meeting chaired by Chief Minister Nitish Kumar. The number of staff will be limited as per union government guidelines. Social distancing will be maintained in all offices and workspaces. The number of casualties due to coronavirus has gone up to 2 with the death of a youth of Vaishali district of the state. 42 patients have recovered. 85 positive cases have so far been reported from different parts of the state. The Siwan district has the maximum number of cases with 29 patients so far.
In Uttar Pradesh, online classes in all secondary schools will start from 20th of April. Education Minister Dr. Dinesh Sharma announced that the classes will run online from 8 a.m. to 2 p.m. daily using all available digital platforms and WhatsApp groups.
The State Education Department is going to provide online education to 1.8 crore school students of the state. Under Mission Prerana, Uttar Pradesh Education Team is working on online learning of students through Diksha app and capacity building of teachers. UP's State Council for Education Research and Training and Content Cell based in Lucknow is now providing 3,000 videos with relevant chapters in the state syllabus using QR codes. Through e-Pathshala, all content will be provided to students and their parents with the help of TV, radio and other digital platforms. More than 270 universities and colleges in the state have already started online classes and providing online content to the students. Sushil Chandra Tiwari, AIR News, Lucknow.
The total number of corona patients in Madhya Pradesh has reached to around 1,310. So far, 16 have died of infection while 68 have recovered. There are 842 patients in Indore and 197 in Bhopal. The state government has said that due to increased testing, the number of COVID-19 patients in Indore and Bhopal has gone up. In Indore, 3.9 lakh people have been surveyed so far, and the city has been divided in 11 zones. 489 teams are deployed for health survey of people. Officials said that 80% of the patients in Indore come from 3-4 localities, and the pandemic would soon be under control.
In Madhya Pradesh, the state government has decided to extend the tenure of presidents of rural bodies like district and block panchayats. The government says that it is not possible to hold elections in current circumstances. Now, an administrative committee has been formed to run the district and block panchayats. All the existing members have been included in it. A report.
The Chief Minister said that these representatives act as an important link between the administration and the public. Given the responsibility of the rural representative in this hour of crisis, their tenure need to be extended. Meanwhile, officers and employees of the state government will donate 100 crore rupees to the Chief Minister's Relief Fund as contribution for the fight against COVID-19. The amount will be deducted from their salaries of this month. The employees unions of the state have requested the government to deduct 1 day's salary to deal with the corona outbreak. Sanjeev Sharma, AIR News, Bhopal.
A recovered COVID-19 patient in Madhya Pradesh returned home yesterday. She appealed to people to stay at home and follow all directions.
मेरी लड़की अभी भी पॉजिटिव है 9 साल की, तो प्लीज मैं आप लोगों से रिक्वेस्ट करती हूँ, स्टे होम स्टे होम स्टे होम प्लीज. सबसे रिक्वेस्ट है मेरी, अपनी जिंदगी की कीमत पहचानो. आप अपनी फैमिली के लिए बहुत इम्पोर्टेंट हो, इस बात को आप समझो सब जने. प्लीज डॉक्टरों की हेल्प करो. और ये हॉस्पिटल में अच्छी फैसिलिटी दी है. 17 लोग यहाँ आए थे, 17 में से हम 14 लोग स्वस्थ होकर घर जा रहे हैं. 3 लोग अभी हमारे हॉस्पिटल में हैं. मजाक में मत लो. एवरी मोमेंट इज स्पेशल व्हेन यू आर इन अ फैमिली. प्लीज stay home.
Maharashtra recorded 118 COVID-19 positive cases in the last 24 hours, taking the total number of cases to 3,320. 7 deaths were reported, taking the death toll in the state to 201. 331 persons have been discharged so far. 61,740 people have been tested for coronavirus across the state till date. Chief Minister Uddhav Thackeray, in a statement issued in Mumbai, has said that some industrial and commercial activities will be restarted from April 20th based on compliance with norms in place to combat coronavirus. He clarified, however, that the decision to restart businesses will not be applicable to coronavirus containment areas. The Chief Minister said, as per the revised guidelines to mitigate hardship caused by the lockdown, select activities have been allowed subject to strict compliance of existing guidelines.
The Pradhan Mantri Garib Kalyan package is providing relief to the poor and the needy during the lockdown. Benefits are being distributed under various components of the package, including food grains, cash transfers, and the PM Ujjwala Yojana. Food grains are being distributed under the PM Anna Suraksha Yojana in Maharashtra as well. A report from our correspondent.
In view of the lockdown, the central government, under the Anna Suraksha Yojana, has started distribution of wheat and rice at a subsidized rate to the poor and downtrodden laborers and farmers' families, following which from April 13, distribution of 5 kilograms of rice has been started to every family member in Sangroli village in Maharashtra's Nanded district through the local ration shop. In the first phase of this distribution system, ration shopkeeper Santosh Bamne started this at Sangroli village nearing Telangana border. Speaking to All India Radio, he said,
हम लोगों ने ये फैसला लिया था कि सरकार की तरफ से जो राशन दिया जाता है वो राशन हर किसी को घर के सामने जाके उन्हें मुहैया कराया जाए। के तहत हम लोगों ने हर घर के सामने जाकर उन्हें राशन मुहैया कराया है।
In the second phase, under the Pradhan Mantri Garib Kalyan Yojana, every beneficiary is being home delivered 5 kilograms of rice since last 2 days. The Sangroli village Sarpanch Venkat Patil Siddhanod flagged off the scheme. Sonali Ghadiyar Patil, AIR News, Mumbai.
Manoj, resident of village Kishangarh in Chandigarh, said that he appreciates the free rations he received under the PM Garib Kalyan package.
मेरा नाम मनोज है, मैं किशनगढ़ का निवासी हूँ। हमें यहाँ पे गेहूँ और दाल प्रधानमंत्री गरीब कल्याण अन्न योजना के तहत फ्री में दिया जा रहा है, जिसके लिए मैं प्रधानमंत्री जी का तहे दिल से धन्यवाद करता हूँ।
A construction worker from Bihar working in Manipur also thanked the government for providing rice to every migrant worker.
हम लोग मुजफ्फरपुर का है, बिहार का। समय मणिपुर स्टेट में आए हैं काम करने के लिए। लॉकडाउन हुआ है इसलिए हम लोग बहुत मुश्किल हो गया है। आदमी पर 4-4 केजी चावल मिला है। हम लोग 15-20 आदमी हैं। वो चावल मणिपुर सरकार हम लोग को हेल्प किया है, मदद किया है, इसलिए हम लोग थोड़ा खाने पीने के लिए मिला है, नहीं तो हम लोग बहुत मुश्किल होना था।
The well-known and keenly awaited Chittiraya Chariot Festival of the Madurai Meenakshi Temple in Tamil Nadu has been cancelled this year due to the prevailing situation. Taking into consideration the widespread popularity of the celestial marriage ceremony, the temple administration announced yesterday that the rituals associated with this will be conducted by 4 Shiva Acharyas in the temple. The event will be telecast live on the temple website www.maduraimeenakshi.org between 9 and 10 a.m. on May 4th, 2020.
And now, an overview of today's newspapers covering COVID-19 stories. RBI throws second rupee 1 lakh crore lifeline, prompts banks to lend more, headlines at Times of India. RBI gives a second booster dose. States get to borrow more, easier terms for NBFCs. Liquidity is the headline in the Indian Express. The move led to the Sensex ending 986 points up and rupee rebounding 48 paise, writes Hindustan Times. The Tribune reports government sources are saying that the lockdown has slowed the spread of COVID-19 and cases are now doubling in 6.2 days. The Times of India headline reads, a rate of growth in cases down 40% since April 1, doubling rate rises to 6 days from 3 earlier. As a direct fallout of the pandemic, India's largest IT employer TCS aims to significantly reduce the amount of time its employees spend in office in the next 5 years, reports the Economic Times. Mail Today highlights the agonizing wait for non-COVID patients in Delhi. The paper writes there is little relief for thousands of patients, triggering brawls at hospitals.
And now, before we end the special news program on COVID-19, the headlines once again. Health Minister Dr. Harshvardhan instructs New Delhi hospitals to take proper care of non-COVID patients. CBDT refunds over 5,204 crore rupees to help MSMEs. The rate of doubling of COVID-19 cases improves to 6.2 days in the country from 3 days due to the lockdown. Government extends regular and e-visas of all foreigners stranded in India till May 3rd. Prime Minister Narendra Modi conveys India's full support for the joint African effort against the pandemic. And US President Donald Trump unveils three-phase plan to ease lockdown and reopen US economy. And with that, we end the special news program on COVID-19.